Hello everyone and welcome back to section 2 of this GreenShield cannabis safety training. Now in the second section we're going to be talking more about the social impacts of cannabis and where cannabis stands in terms of legalities and the law. So without further ado, let's start by talking about why the law changed in 2018 and what's actually triggered most of this cannabis conversation. So back in 2018 and before 2018, there was a lot of patients trying to access cannabis and argue for its legality and advocate for the medical applications of cannabis and its use. And so in 2018, there was an organization formed which basically advocated for the use of cannabis in children with epilepsy. Now, one of the key studies that led to the law change was a study conducted by Drug Science, which looked at the reductions in seizures and the frequency of seizures when cannabis products were introduced into these children. So many of these children were experiencing hundreds, if not thousands, of seizures per month. Most of these children had not known a life without seizures, and every day they're experiencing seizures, and that was their reality basically. And obviously seizures can be fatal and are incredibly damaging to the development of the brain as well in humans. And so in this study what they found was that seizure frequency was reduced by nearly 86% when these cannabis medicines were administered to these children. So this is providing life-saving therapeutic relief that no other drug that was prescribed by the NHS or available in the NHS was actually able to achieve. And so these patients, these families were transitioned over to cannabis medicines, and they were experiencing a life without seizures for the first time. Now, for those families that were part of this study, the average cost per month of these life-saving medicines was nearly £1,000 per month. Now, there are cases where patients who are maybe larger or older are requiring quantities that cost multiple thousands of pounds a month. So to support other families with the costs of these prescriptions, a lovely charity was formed called Intractable. Now you can follow their page and support their program and their initiative at their website, but essentially what they're doing is helping patients with the costs of these prescriptions and helping children access this life-saving medicine and life-changing medicine as well. All of the costs of these medicines currently lie with patients, and this is something that is really holding back the access to these medicines and the adoption of these medicines. There's still a lot of issues with the law as it stands. There's still a lot of issues with the industry that was created as a result of this law change. And there's still a lot of gaps in the medical system that are negatively impacting patients and also the British public as well. So in the UK, cannabis is currently the most widely consumed illegal drug. And everyone from 16 to 24-year-olds right through to professionals and business owners are consuming cannabis. You find grandparents using cannabis, you find parents using cannabis. And so because of the current legal setup, this leaves 99% of the British public criminalized and potentially targeted by the law if they're found with cannabis without one of these authorizations or without one of these certifications. Given that cannabis is illegal, why would so many people use cannabis and what are the purposes of it? Well, in addition to a number of people using cannabis products to treat their ailments and different medical conditions, a research group identified that in 16 to 29-year-olds, oftentimes these people are using cannabis to relax because they're bored, they want to feel better, whether it be with their mental well-being or their physical well-being. They're using cannabis to sleep, and in some senses just to keep going. They're bored with life, they're struggling with life, and cannabis is something that actually helps them move through life and overcome the problems and challenges that they're facing. So there's a lot of uses beyond just the actual medical applications in, say, arthritis or gut disorders or pain. There's also a lot of different social dynamics here that maybe aren't always acknowledged or discussed when it comes to talking about cannabis use and the motivations for that cannabis use as well. So when we talk about cannabis use, there's also a lot of hidden dangers that come about from either sourcing the products or consuming these products. Now, we've mentioned synthetic cannabinoids earlier on, but One of the issues and what makes synthetic cannabinoids particularly dangerous is that they're odorless, they're hard to identify and detect, and they're also incredibly potent. And oftentimes when we put them in a human, or when a human consumes these, the side effects are significantly more severe, and you can actually die from consuming synthetic cannabinoids just because of how potent and dangerous and potentially damaging these can be. Now, between 2012 and 2019 in the UK, there were 165 synthetic cannabinoid related deaths, and over 18 different synthetic cannabinoids were detected. And these compounds find their way into mainstream consumption. They might be mixed in with organic cannabis, natural plant cannabis, phytocannabinoids. For example, if you're buying gummies or some of these sweets that are meant to be a new way of consuming cannabis, there could be anything in those products. So the key is making sure you know your product, where it's come from, who's produced it, how it's been produced, and that way you can reduce the risk of potentially consuming some of these synthetic cannabinoids accidentally and potentially damaging yourself, or one of your friends getting hurt, or a family member getting hurt. The costs associated with the enforcement of our drug laws are really quite substantial, and each year £1.4 billion is spent on enforcing our drug laws, and 690 million of that 1.4 billion is spent on the policing costs that are required to enforce these laws, and 733 million is spent across the criminal justice system through courts, legal proceedings, and also the costs of imprisonment and probation as well after leaving prison. And so you can see just how much of an issue this is for the UK. You can see how much of an issue this is globally as well when it comes to the global cost of enforcing these laws. And despite us spending all of this money, drug consumption is at an all-time high. And so the questions we need to start asking are there other ways that we could potentially deter cannabis use, make cannabis use safer, make drug use safer, without having to just keep throwing more and more money at enforcement? At the moment, there is zero education on responsible drug use, how to use drugs safely, and what to do with drugs if you are offered them as well. And so part of this program's initiative is to provide that educational foundation, provide that safety information, so that we can reduce these accidents and reduce the harm associated with cannabis right across society. Another big issue at the moment is cannabis and driving. The average impairment window, the average amount of time that you are impaired by cannabis if someone consumes it, is between 3 and 10 hours. Because of the nature of cannabis, it aggregates in your fat, it aggregates in your body once it is in your body. THC and other phytocannabinoids can be found in your body weeks after consumption. Now, when it comes down to driving, if they're testing your blood and it happens to be in your blood, which it will be if you are a regular cannabis consumer, you will find yourself on the wrong side of the law and potentially losing your license, or potentially facing jail time as well. What's interesting about the relationship between alcohol, cannabis and driving is that cannabis consumers typically compensate for their impairment more effectively than drinkers do. So what this means is, if someone's consumed cannabis, they'll probably be aware that they're intoxicated, and they'll drive probably more slowly and more carefully than someone that has consumed alcohol. So if someone is impaired with cannabis already and then they mix that with alcohol, that's going to increase and exacerbate their intoxication and mean that they're even more impaired when it comes to driving that vehicle. The earlier that someone starts using cannabis, the more severe their impairment typically is. Now, the reason for this is that cannabis affects our impulsivity, and people who start consuming cannabis at a younger age typically are more impulsive and struggle more with controlling their impulsivity when it comes to other aspects of life. These are all factors that you need to consider if you are working or potentially driving and consuming cannabis products, or looking at receiving a cannabis prescription as well. So when it comes to cannabis and drug driving, there are a number of penalties that you should be aware of if you are even considering consuming cannabis products and looking to still conduct yourself safe. If you are found to have cannabis in your system, there is currently a zero tolerance on THC in the blood. So any cannabinoids, any THC found in your blood will mean that you are penalized for drug driving. Now, the penalties for this are a minimum 1-year driving ban, potentially unlimited fine, and up to 6 months in prison if you are driving dangerously and potentially damaging someone's health. If you cause harm to another individual, or God forbid kill them whilst under the influence of drugs or drug driving, you're looking at potentially life in prison as well. And so this is something to be taken incredibly seriously and to be heavily considered before you do start consuming CBD products, consuming cannabis medicines. If we take a look now at what the Home Office says about cannabis, CBD and cannabis products, CBD as an isolated substance is legal. Now, what makes this difficult to enforce is that when we talk about cannabis products, there's not just CBD in there, and so this opens you up to potentially breaking the law. Most CBD products do contain other elements of the cannabis plants and some of the illegal elements of the cannabis plant as well. So sometimes you'll find THC in your CBD products, which isn't meant to be there. This is why it's really important that you ask for your certificates of analysis when you are buying CBD products or cannabis medicines. If you don't know exactly what's in that product, it's not worth taking the risk and potentially endangering yourself, your livelihood, and the health and safety of the people around you as well. Cannabis is now a Class B drug. It may be lowered to Class C again, or it could be elevated to Class A. If you are found in possession of cannabis illegally without one of these authorizations, you're potentially looking up to 5 years in prison, an unlimited fine, or both prison and a fine. If you are found supplying and producing cannabis illegally, it's potentially 14 years in prison and again a fine, or both prison and a fine. And the law is still very strict on cannabis and other drugs. The vast majority of the British public do still fall into this Class B category. If you're possessing, supplying or producing these drugs without the authorizations, licenses or prescriptions, you are looking at potential criminal charges. So when it comes to the actual safety of drugs as a whole and the whole array of drugs, the law doesn't necessarily reflect what the science says, and the law takes a long time to catch up to where research is at the moment. This study in 2015 showed us that cannabis and some of the other drugs such as cocaine and ecstasy are actually less toxic and damaging to the body and have a lower prevalence of risk and damage than readily accessible drugs such as alcohol and cigarettes. So as researchers have begun to dig deeper into the motivations behind drug use, they've identified adverse childhood events as one of the primary motivators for drug consumption in the community, drug consumption by individuals. So these adverse childhood events are traumatic events that occur in the early ages of life. This can include enduring or being exposed to abuse, neglect, family violence, the arrest of a family member, mental illness in the family. The separation of your parents can also count as an adverse childhood event, or substance abuse amongst family members, and even the death of a relative can negatively impact your later life if these occur at a young enough age. And so pretty much everyone knows someone that has experienced something like the death of a relative, parental separation, abuse or neglect in some way. And so people who have experienced 4 or more adverse childhood events in their lifetime have an overall increased likelihood of later adverse health, obesity, potentially smoking, imprisonment, later life issues, compared to someone who hasn't experienced an adverse childhood event. And so by preventing ACEs, we could reduce the number of adults with depression by as much as 44%. So that shows you just how much of an impact adverse childhood events have on later life, adult life, and the quality of life as you get older. When we dig deeper into this issue, we see that 61% of adults have had at least one adverse childhood event in their life. Anything up to 2 adverse childhood events can lead to later physical inactivity, obesity or diabetes later on in adult life. Up to 3 can mean smoking, alcohol use, poor self-related health, cancer, heart disease, respiratory diseases as a result of that self-neglect. Up to 5 ACEs, there's often strong sexual risk-taking, mental health issues, and problematic alcohol use and other problematic drug use. So someone who has experienced up to 7 or more adverse childhood events is incredibly likely to have some sort of problematic drug use. This can result in violence, whether that be interpersonal violence with people around them or even self-directed violence as well. So you can see just how impactful and damaging and dangerous these adverse childhood events are on later life. These are really important factors that aren't looked at when we talk about drugs, drug use, and people who use drugs. There is now a model that's emerging, and a research model that's emerging, called harm reduction, which basically states it's a pretty much an inevitability that portions of the population will consume drugs based on these adverse childhood events and other issues in their life. So how can we actually make that drug consumption safer? Rather than putting these people in prison and keep dragging them through the criminal system, how can we actually facilitate health, facilitate their well-being, and actually start improving society and having a more well-rounded, evidence-based approach to helping people who use drugs, and also support the safe use of drugs and reduce the harm associated with drugs. So first of all, one of the key principles of harm reduction is engagement, speaking with those drug users, speaking with communities, speaking with the public, like we're doing here, building awareness, building relationships, and trying to build a community that understands and addresses these issues in an open and communicative way. As well, then, if we can actually build communities where we're reaching out to people, we're building projects that are actually educating people and engaging with people in the community to solve some of these issues, support people through these issues, and help them manage some of these adverse childhood events potentially and other factors that are affecting their life, to then start actually making sure that we're measuring and showing how the community is benefiting from these harm reduction approaches and harm reduction principles. We need to start gathering data on that. So whether that be empirical data, i.e. capturing numbers, looking at statistics, or whether that be experiential data, interviews, conversations, and getting feedback in the verbal format. This is what the science is showing us now, and this is where the law really needs to catch up to in order to be able to move our drug policies into the 21st century that has far better outcomes for individuals and also the communities around them as well. So this brings us to the end of section 2. We'll see you soon in section 3 to talk more about how you can actually protect yourself in this ecosystem, what you need to know to stay safe, and we'll give you all of the essential information around cannabis safety, safe use, and how to use cannabis products safely and effectively. We'll see you soon.